Thank you guys for joining this episode of APAP Podcast. Comes to you from the Professional Development Committee. I'm Haley Hoy. I'm one of the members, and our chair, Alana Kavanaugh, sends her best. We are joined by Sarah Krauss from University of Iowa College of Nursing and the University of Iowa Hospital, as well as Stacee Lerret from the Medical College of Wisconsin and Children's Hospital of Wisconsin. So the title is Turning Your Idea into an Abstract and Practical Approach. And we were told as part of the Professional Development Committee that this is an area that many clinicians, and we know this to be true in pulmonary, have difficulty with. It can be difficult getting started. So we're really hoping this presentation will be a little bit of a mad lib for you to take any idea and create an abstract. So let me turn it over to Sarah Krauss to get started.
Thank you, Haley. I just want to introduce myself and my role here. So I am a clinician and an academic. I worked in pulmonary as a nurse practitioner at a large academic medical center in the Midwest for over a decade now. And I specialize in chronic disease management in adults. And I also serve as associate director of our lung cancer screening program. 2 years ago, I decided to expand my professional journey into academia. And I joined the faculty at the University of Iowa College of Nursing as an assistant professor on the clinical track in our graduate nursing programs. So with that role came a small dedicated percentage of scholarship time, which meant I really had to figure out how to engage in scholarly activities. And I also wanted to expand my own professional development. So that's put me on the path of research and scholarly writing and led me to join the Association of Pulmonary Advanced Providers and the Professional Development Committee. So if you're wondering how to start your own scholarly journey, you're in the right place today. So we're talking about moving an idea to an abstract and why it's important for clinicians to write abstracts in the first place. First of all, it's about sharing knowledge and improving practice. Abstracts allow us to disseminate findings from clinical projects, quality improvement initiatives, or evidence-based practice changes. This helps others learn from your work and also apply similar strategies to improve patient care in their own settings. Second, it's a huge boost for professional development. Writing abstracts builds skills like critical thinking and concise communication. It's often the first step that you take toward making a poster or doing a presentation or writing for a publication. These things all strengthen your CV and they open doors for leadership roles. Third, why I think it's important to write abstracts, clinicians are on the front lines. We see gaps in care every day, and we want to turn those observations into practice change. And that's what abstracts help us do. They advance evidence-based practice, and they ensure that real-world insights inform guidelines and policies. And finally, abstracts create opportunities for networking and collaboration. Conferences connect you with peers and experts. That leads to mentorship and partnerships. Plus, scholarship is increasingly valued in clinical roles, especially in academic medical centers. Abstracts help demonstrate engagement and can also support promotion and recognition. So it's not just about checking a box, it's about amplifying your impact. So we're going to get started on these slides here. So think of this as a roadmap. That's what your abstract is. The goal is to make the process clear and manageable. So what is an abstract? First things first, what is this? It's a concise summary of the major parts of your project, of your research study. Think about it like your elevator pitch in written form. So you want to, step one, start with the criteria. This is really simple but powerful. You want to download the submission criteria for whatever organization or conference that you're submitting an abstract to. Make sure you have the submission criteria, paste them into your document. That helps keep things aligned with the requirements from the start. And you want to make for sure that you note the word count. It's really easy to overlook that, and that could make the difference of your abstract getting accepted or not. So step two, you want to save the title for last. Why? Because your title reflects the essence of your finished abstract. You want to review brochures from the organization or the conference from the last 2 or 3 years that you're submitting to. Look at the themes and objectives. And it really helps if you know somebody on the review committee or if you have a friend of a friend, um, that can help give you the ideas that you need to get your abstract accepted. So, what are the parts of an abstract? We're going to break this down. In general, you'll need a title, background, purpose, method, and this is your sample or your procedure, or the instruments that you use to conduct your project, and then your results, and finally, the implications for practice. The title is key. When you do write down your title, make it count. Include your key variables like the population you studied, and if possible, the design of your study. Here's an example of descriptive analysis of medication adherence in a cohort of rural teens. This title is very clear, specific, and informative. The background section shows you understand the literature and why your project matters. So it highlights the relevance and need for your work, and it briefly connects it to existing research. In short, you really want to explain how your study contributes to the bigger picture in the background. And now I'm going to hand it over to Stacee for the remaining slides.
Thank you, Sarah. On this slide, we outline the best practices for crafting a clear and effective purpose statement. First and foremost, the statement should contain the word purpose. We use the word purpose because here we want to make sure we're clearly identifying its function to the study itself. This avoids any ambiguity about what the study aims to achieve. Now, you also, in the purpose statement, want to include what you're studying and the population of interest. This immediately narrows the focus and tells the team who was studied and what was measured. It's crucial that this statement be written in the past tense because by the time that you are submitting the abstract, the study has already been conducted. So you want to make sure you're reflecting that reality in your language. Here is an example that illustrates how to put a purpose statement together. The purpose of this study was to evaluate the effect of a formal transition team on medication adherence in adolescent lung transplant recipients. So what do we see here? This sentence meets all the criteria. You have the word purpose. You're also defining the population as adolescent lung transplant recipients. And then you identify the variables that you have this transition team and the measurement of medication adherence. The methods is the next component of an abstract. And there are a few sections that you need to make sure you comment on in order for the reviewer to have an idea of the full scope of your project or study. So specifically, you want to speak to design. Was this a quantitative study where you were primarily using statistics? Was it qualitative, where you were interviewing people, doing focus groups? Now, this may also be a QI project that you did. So being able to state specifically the design for with which your project took place is important to share in your abstract. The sample has a few criteria that you want to make sure you are addressing. Who were you studying or what was your focus for this project? How many people were part of this project? It may also include length of time for with which you enrolled participants in a study or how long your QI project took place. And then where did it take place? Was it at a single center? Was it at multiple centers? Was it one program within your hospital? Was it multiple transplant programs within your hospital? The procedure also tells the reviewers how you did the project. Okay, so for example, if you use instruments, you want to make sure that you're saying that you used valid and reliable instruments. Now, if you didn't use a valid and reliable instrument, that's all right as well. You simply want to make sure that you are providing information about what you used. So maybe you developed investigator-initiated instrument. You can say that as well. It doesn't have to be, as I said, a valid and reliable tool. Now, this is a comment here about consulting with a senior researcher or statistician. This is not something that we're recommending you put into your abstract, but something that you consider that will help make sure that in the next section, in the results, you describe everything and explain things appropriately. So throughout the scope of your project, make sure that you're using senior researchers, statisticians, or other experts along the way. So here is an example of an appropriate method section statement. A quantitative descriptive design was used to study 118 adolescent lung transplant recipients from a single center in the southeastern US using SF-36, a valid and reliable tool. So let's go through this statement. You can see we meet the first criteria, design, by saying it's a quantitative descriptive design. Great, check, done. Sample, who was it? Adolescent lung transplant recipients. How many? 118. From where? It was a single center in the United States. And then what procedure instrument did you use? This SF-36, particularly then assessing quality of life for this particular study, and stating a valid and reliable tool. The next component of your abstract is the results. It is important to list only the results. While this may seem like a simple statement, it's very easy to start moving beyond results and saying what you think these results mean. But again, be very careful to only list your results and hold on to what those mean for the next section. So again, the results are simply that. They are not an interpretation of what those results mean. The results may include descriptive statistics. So again, this would be describing your population in a quantitative manner. For example, you may list the average age of your participants. Could be 48.3 years. Then you would list your range of 21 to 64 years. It would also include potentially racial and ethnic variables, as listed here. You may also, if you're utilizing a quantitative design, have inferential statistics, where you're using t-test or regression model. If you have a qualitative design, this is where you're going to list your themes that resulted from the focus groups that you potentially conducted as part of your research. Here is an example of a good results section. I am not going to read it directly to you, but what you will see is me highlight these components that we said were important. So you can see the number here during the study period is called out at 2,400 adult patients. You see the diagnosis. This is HCC or hepatocellular carcinoma. You see that they were all analyzed on a particular regimen and for at least 6 months, including a time frame. And then here's information about the demographics of the sample, particularly saying that the female-male ratio, the age of the participants. Then they talk more about the incidence of the particular virus, induced liver disease, higher among the patients. And you can see the p-value here. So that's an important indication indicating statistical significance. And then they're also giving additional information about the scoring system and the p-value listed there. So it's including all of those components that we said were important, and most importantly, not inferring anything more about what these results mean. It's strictly the data. This slide provides some guidelines regarding effectively discussing implications for practice. This section is often where the real world value of your work shines through, amplifying what you have done and how it relates back to practice. What you want to avoid is broad statements, okay? Think about pearls from a conference. Those are the things that you're taking home. You want to make sure that you have key takeaways or insights that are immediately actionable and memorable. You also want to clearly articulate how your results can be used in practice, emphasizing the immediate application of your findings. So there was lung transplant adolescent recipients at a single center, although maybe you can make a statement how this can be considered as a framework to be used in other adolescent lung transplant recipients, so that people can consider using the transition program as part of that. You also want to relate back to your purpose. So this is taking you back to that background section that Sarah mentioned and reminding people about your purpose. Okay. What was your purpose? What did you find? And reminding them of why the study was important to be conducted in the first place. And then you may have an opportunity to offer a real life example, relatable scenario. This helps the abstract reviewer to really visualize how the findings translate into everyday practice and making that information stick, reminding the reviewers of the relevance and the importance of your project that your abstract found. Specifically, once you are done writing all of these components, you want to take a step back. This is where you can do this on an individual basis. You may also want to ask a colleague to review your abstract as well. You can use this evaluation section, or you can also use the guidelines that were provided to you from the conference agenda. So it takes you through all of the components. Remember that you want to make sure that your topic is important. This is listed in the background section where you're saying that there's some kind of gap, some additional knowledge that you feel is important that you want to share with individuals or that you wanted to investigate further. The problem or situation there is clearly described that then moves you to your purpose statement, right? So your purpose statement then speaks to, using the word purpose, why you did the study and involves moving the work forward. What gap are you trying to fill? What new knowledge are you stating? The methods and practice are clearly listed and make sure that they are appropriate and then also fall in line with the results that you are describing, keeping the results strictly that, the results only, and stating the conclusion and implications for practice as to how those results move your work forward. So now what I would like to do is bring this back to Sarah to bring us to our question and answer section.
Thank you, Stacey. That's all so helpful. I think it's really hard to know how to get started. I am a novice scholar, and I just have a hard time knowing how to get my work off the ground and what ideas are really going to matter out there. So I have some questions for you both. So first of all, just how did you get started?
Well, thank you, Sarah. So I was involved at an academic medical center, but working full time as a clinician, and I was part of a quality improvement committee or group. And they very much encouraged me to submit an abstract, and it wasn't something I was comfortable with. I can tell you I would have loved to have had these Mad Lib slides that Stacey and Sarah have provided for you to just, you can truly just take their information, pop theirs out, and pop your information into the format, and it helps you so much. But that group was really instrumental in my success. What about you, Stacey?
I had a very similar story, Haley. I was practicing in my clinical setting, and there were certain situations that came up that gave me a pause and said, how can we improve this? And that resulted me speaking with colleagues and moved me forward to write my first abstract. Although I needed a lot of help because, as you said, I didn't have a guide and I didn't know where to start. And uh, a word that you and I have used in the past when we've talked about trying new things is that paralyzing word. You can really be paralyzed by the fear of the unknown. And hopefully these slides allow you to see that it's not such a difficult process. And when I worked with this mentor, he walked me through the process of it as well. And then I kind of caught the bug and I kept answering more questions based on clinical needs that I found. So you yourself, listening to this podcast, might be saying, I've had this clinical challenge or this issue, or we've been working on this QI project and we've found these results that may be very helpful to other programs. So think about how you could share those and utilize these steps to potentially share these at an upcoming conference.
Yeah, thank you both. That's so helpful. It's really, really tough to know how to get things off the ground and also how to find somebody that you can trust to help you. How did you both find mentors to help guide you through these processes?
Well, thank you, Sarah. For my mentors, I've had many through the years because one was the person on that quality improvement committee that helped me with my first abstract. And then as I moved into quality of life research, I had a mentor at the College of Nursing who was very much into quality of life research. And then as I've moved forward, I've had mentors in, as Stacee said, certain methodologies. So it's really just finding either within a college, an academic center, or a community hospital where there are people conducting research, and just inviting yourself to the table at committee meetings. What about you, Stacee?
I echo what I said with the last response is that I have had a very similar experience. And I think this is a reminder to everyone that mentorship doesn't have to be formal. You don't have to say, will you be my mentor? It doesn't have to be that. It doesn't have to be that formal. It can really be, like I mentioned, reviewing the slides. Would you review this abstract for me? That is a form of mentoring. And just like you, Haley, I have had different mentors throughout my career that have fostered my growth in different areas. I have had one that's followed me along my entire journey, which has been incredibly helpful to help guide me in different ways. But as you said, as new skills need to be developed and I need different things, I have utilized and asked different people for help. So you can have multiple mentors, someone for writing, someone for the method, someone just for encouragement. I think also uh, the piece about encouragement is having someone that may be able to hold you accountable. So Haley and I have known each other for quite a long period of time. And we've worked on a number of projects together. And when you find someone that you can work with, uh, now, while it may not be necessarily a mentoring relationship, there are absolutely things that we both teach one another, but we also hold each other accountable to moving our work forward. And so that can also be helpful, specifically when you have a time frame for with which you have to meet, which you will when you submit an abstract, because there will be a time frame for that. So you can work along some alongside someone to help move you along and meet your deadline. So that's another component, is to have a colleague or a trusted partner to help hold you accountable.
Oh, that's fantastic advice. And I am going to be reaching out to both of you for mentorship because you have a lot more experience than I have in this respect. So I really appreciate the information. So another question, how do you decide if an idea is strong enough to turn into an abstract?
That's a great question, Sarah. So it's the so what factor. Would this matter to the clinicians like yourself? Would this change your practice, as Stacee said, almost immediately? And also, you want to match the theme of the conference. If you get a rejection, then that's just a suggestion that it needs to go somewhere else. But if your abstract doesn't match with the topics that you put at the conference, be sure that it does before you send it. What would you say, Stacee?
I would say that oftentimes we as nurse practitioners underestimate the value of our everyday clinical work. There is so much innovation in what you do every single day. And the so what factor is a great barometer. If it addresses a real clinical need, share it. If it adds something new, even a small improvement, share it. You can explain it in couple of sentences, like we talked about. You can bring a bigger idea down to something that is concise in an abstract and be able to share that work. Because as I said before, we underestimate the things that we do every day. I like to use a phrase that says our ordinary is extraordinary. And it's so true. It becomes our everyday work. But things that you're doing in your practice are likely very different than what I'm doing. And boy, I bet it would improve what I'm doing. And we don't even have to work in the same organ. Where I work in liver transplant, you work in lung transplant, for example, but your processes and how you approach them could very well help me. So again, don't underestimate what you're doing every day, because it's likely extraordinary, and share that innovation to help others.
Thank you. Again, great information. So you did mention something that is terrifying to young researchers, or new, or not young, but new researchers. If your abstract gets rejected, what's your next step? How do you keep going?
Well, you certainly don't throw it away. It's just a not right now or not for this conference. And that goes for an abstract, a publication, a poster. You have those data and you revise it. Sometimes you'll get some feedback and you submit it somewhere else. And Stacey and I have had this experience. And you revise and it eventually will get accepted when it's in the right place. Would you agree, Stacey?
I completely agree. Rejection is part of the process. You don't hear about it, unfortunately, but I promise you it happens to everyone. And it has happened to Haley and myself more than once. Okay.
Yes.
It is. It's part of the process. It's not a fun part of the process, but I try to reframe my thinking when I receive rejection. And I try to take a breath and read those reviewer comments and then use it as a roadmap to revise my work and move it forward. The revisions strengthen the weak spots. Okay. And it does indeed make your work stronger. It doesn't feel that way in the beginning. It does feel like a judgment, but try to reframe your thinking and remind yourself that it is not a judgment. Persistence, resilience is a core skill in scholarly work. It is incredibly important. And it is, as Haley and I both said, it is part of the process and it happens to all.
Thank you. I think my takeaway from that is don't give up. Keep going and don't ever delete what you've done. Get rid of it. You might be able to pull it out sometime in the future. One other question. What are the biggest barriers and your advice for overcoming them when you're starting this journey? What kinds of things did you have to overcome to get your work out there or maybe even get started on a project in the first place? I think that's something that especially clinicians struggle with is trying to figure out how to make everything happen together.
Well, I think it's just like in the clinical field, it's time. Many of our physician colleagues, whether we're PAs or NPs or other advanced practice providers, we don't usually have time off service. We don't have dedicated time for scholarship. But as Stacey mentioned earlier, we use each other as accountability partners without a due date. The things you don't like to do or maybe you're not comfortable doing never bubble up to the top. So I had to make myself in the morning, I'm a morning person, have a dedicated time period to work at it, both so that it didn't get cold and I didn't know what I had worked on, but to make myself do it. What about you, Stacey?
I would say that the scheduling time is incredibly important because clinical practice always takes priority. And scheduling that time in your calendar then at least gives you a little bit of a block. You may not be able to utilize that entire time, but at least you're reminding yourself that you need to stay on top of that work. I think the other thing that I want to point out is something that people think goes away, but doesn't, and that imposter syndrome. Okay. Even though I've been doing this for a handful of years, it doesn't mean that I feel any differently than you do. Okay. When you put your work out there, you genuinely feel vulnerable. I think that's natural. And you're worried that someone will judge your work, right? I spoke to that when I talked about the reviewer comments, that I try to reframe my thinking and make sure that I say, they're not judging me, even though it feels like that. So I need to take a step back. And I feel the same way putting my work out there. I don't want to hear someone say that that was not relevant or not important or not a great project. And I think that's one of the things that can be challenging moving forward. But I'm telling you, scholarly work doesn't have to be perfect. Okay. And sometimes you may not learn exactly what you anticipated you would learn, but there is oftentimes more in the things that didn't work out that move your work forward than what you expected you would find. So don't let unexpected findings hold you back or say, I shouldn't submit this because there are more ideas that come from that. And simply get started. Write. The sentence that you write on a piece of paper doesn't have to be perfect. The first abstract doesn't have to be in the 350 word limit, should that be the number that it is. I don't use complete sentences all the time. I'm just getting ideas out, and that's okay. So don't let the perfection piece hold you back. Haley, would you add anything more to that?
Absolutely. I think that was very well said, Stacey. I would take the slides from this podcast where the abstract is done, mark out the subject matter that we have, insert your subject matter, see where you have holes, and seek out a mentor. And we're happy to serve in that role as well. And we hope this has been helpful to you. We're at the 30-minute mark, so I'm going to bring it to a close. Please don't forget to get your CE either from the show notes or from the APAP website. I want to thank you again, Sarah and Stacee from the whole Professional Development Committee. This has been wonderful and exactly what we needed on a step-by-step. I will do a shameless plug that we will be continuing this in a workshop format in the June 2026 APAP meeting, which will be in Las Vegas. But please, just as Stacee said, just get started. Cut and paste the abstract that they provided that will be in the notes. And we will see you at the APAP annual meeting, where you'll have the opportunity to take your idea to an abstract and then to a poster and a publication. So again, thank you all for being here. And from APAP, thank you for joining our podcast.